Hi everyone, welcome back. So today's topic is sort of another pregnancy related one. I'm going to be talking about fertility massage. I'm sort of seeing more and more people sort of advertising this online, and so wanted to just talk about whether it's something, is it actually a thing? Obviously in the field of massage, we're seeing more and more the introduction of sort of specialized skills, which is a way for therapists to, just stand out from their competitors. Fertility massage is an example of, this type of thing. And as I say, the question is, how valid is this as a specialist service? And should it be seen as something that is ethical? Which I will go into. We know infertility, obviously I've seen it as a midwife. I, for a time, was told I would probably never have my own children. We know that infertility can cause an overwhelming amount of psychological stress, which, can really place couples in quite a vulnerable position, where they will just become desperate to try anything that will claim to have success in terms of being able to help them get pregnant. And as therapists, we have to be accountable for our own practice, and we have to be honest in what we say to our clients, in the way we advertise, and also we have to be ethical, in our advertising and discussions. Now, it's thought that around 15% of couples, are unable to conceive after a year of unprotected sex. Now, fertility declines from around 35 years old for both men and women, with a significant decrease. We think probably about 50% decrease in fertility for women by the age of 40. Now, infertility can also apply to women who maybe can conceive but are unable for whatever reason to sustain the pregnancy and carry to term. And it can also, certainly it obviously there's a psychological stress, but infertility can also really affect sexual well-being as well. And certainly we know that when there's a lot of psychological stress, this then gets projected onto the body, and is kind of exhibited as a physical muscle tension. So certainly, infertility is an area that, as massage therapists, we should address. There are certainly a lot of issues there that we can help with. But as I've said, we're seeing increasing sort of advertisements for, for this fertility massage, like this miracle cure. And it's usually described as an abdominal or lower back massage for clients, not only going through sort of infertility. It can be for any clients with hormonal or reproductive issues, so things like polycystic ovary syndrome, endometriosis, which I've previously done a video on, so do look that up if that applies to you. But also for stress-related conditions. So if there's something like a pelvic trauma that, you know, maybe, you know, you've buried in the back of your mind and not really dealt with, that can also sort of show itself in the form of physical or sexual problems. And I talk a little bit about that in my video on yoni massage. Also, this fertility massage is aimed at women who obviously are trying to conceive but maybe experiencing fertility issues, or even women who are undergoing IVF treatment. And also, it's talked about being a service for women in the pregnancy and postpartum period. So covers, you know, quite a few sort of different areas there. Now, when I see this service advertised, it usually, in terms of the benefits, it talks about promoting optimal functioning of both the digestive and reproductive systems. It talks about sort of a balancing effect on the hormones. So obviously we're talking about, like, in terms of how massage promotes oxytocin and endorphin release, and inhibiting those stress hormones, which places the body in a more relaxed state. You know, lifting sort of stress and depression, and also opening pathways between the endocrine and the reproductive systems, you know, to allow them to function more efficiently. It also, in terms of benefits, talks about scar tissue, you know, helping to release any scar tissue or adhesions, maybe from pelvic surgeries, infections, or conditions, again, such as polycystic ovaries or particularly endometriosis. It talks about reducing pain, again, through the endorphin release and release of scar tissue. And in this way, massage, we know, can help, you know, reduce pain levels. Another one that we always talk about with any kind of massage is the effects on the blood circulation. Improved blood circulation increases the amount of oxygenated blood being transported, obviously in this case, to the ovaries and the uterus, which improves egg health, and also seem to relieve bloating and tension in the connective tissue around those pelvic organs and the surrounding muscles, you know, and in this way it's said to, you know, promote embryonic implantation in the uterus. Lymphatic circulation as well, in terms of, you know, improved lymphatic circulation means that any sort of old stagnant blood is cleared, which relieves congestion around the pelvic organs. And again, this is going to be certainly something that we think about in cases where there's been endometriosis and you've got those endometriotic lesions on the surrounding, you know, on the organs surrounding the uterus. And then the other benefit that is often talked about is in terms of relieving stress. As we know, massage is thought to reduce cortisol release and stimulation, you know, of the sympathetic nervous system. And, you know, research, if we look at it, it has shown that women who are under stress at the time of ovulation are actually less likely to conceive. So that has been shown. But the question is, does this fertility massage, it talks about all these benefits, does fertility massage actually help you conceive? Because surely that would be the point of having one, right? Well, so far, research actually hasn't shown that these fertility massages have a direct impact on fertility. And when you look at the techniques, that are used in these fertility massages and the benefits that we've just talked about, actually, they're the same as other forms of massage, Swedish or deep tissue. Now, as both a massage therapist and as a midwife, I would suggest that anything, therefore, that is advertised as a fertility massage is actually quite misleading. And if you're wanting to try a massage while trying to get pregnant, or for any other pelvic issues, actually all you need to do is look for, a registered therapist who is adequately qualified in this area of reproductive health. Not only, as we've said, trying to get pregnant is stressful enough, but if you already have other stress, say from health issues, for example, this again may kill, the libido before you've even started, trying. So certainly in terms of easing stress, and the other benefits, yes, massage is beneficial, and who knows, it's not been proven, but it may help. You just feel in a more relaxed place, and just, I said this all the time to women when I was a midwife. Sometimes women are so they're so stressed because they're not getting pregnant, and then that becomes their sole focus, is I have to get pregnant, and actually that in itself can actually kind of reduce the chances. And so I'd sort of say to women, sometimes, if you, as hard as it is, if you just kind of try to relax, try to focus your mind elsewhere, and sometimes it will then just happen naturally, without you trying to kind of force it. But I realise it's easier said than done. So yeah, in terms of easing stress and working on any sort of other health issues and, the benefits that we've listed, yes, massage absolutely can help when you're trying to get pregnant. Can it help you conceive? Probably not. So we're now going to look at types of massage for pelvic and reproductive issues. Okay, so certainly deep tissue massage of the abdomen would certainly help to, improve the circulation and ease any areas of tension, around the abdominal and pelvic area. And obviously this, can be combined with relaxation, techniques as well. Reflexology, certainly, in terms of treating acupressure points in the ankles and feet, which correspond to the ovaries, the uterus, the fallopian tubes, again, could just help to sort of unblock those channels in the body. Abdominal massage, I talk about this quite a lot, because so often, you'll go to places, for a full body massage, and certainly if you are going to like a spa or a gym or, one of these kind of massage type sort of centres, they describe it as a full body, and it's not. There's no work around here, there's no work on the stomach, and it is so beneficial for the digestive and reproductive systems. So definitely, again, if I've talked about this in my previous post on endometriosis and IBS. There are a lot of benefits to abdominal massage. Swedish massage obviously can be used, which is perfect if the stress is the big issue. Inducing relaxation when trying to conceive. Would just, as I was talking about, sort of in trying to get women to divert their focus to other areas and not just be like completely driven on I've got to get pregnant. By inducing the relaxation, sometimes you can just sort of help divert the woman's mind, away from from that sort of aim for a while. And also shiatsu massage, which isn't as widely available, but again, this works on pressure points which correspond with the reproductive system and promote relaxation. It's kind of a little bit like reflexology, but for the whole body. So how I'm going to talk about how massage, obviously we've talked quite a bit about the effect of stress on trying to conceive. So I'm going to talk a little bit about how massage can help stress-induced infertility. As we know, stress and emotional trauma can certainly cause the reproductive system to shut down, which can result in failure to ovulate, irregular or no menstruation, miscarriages, etc. Stress may also reduce serum total testosterone levels in men, which affects the seminal quality. So it's not just stress in women that we're talking about, it's also, it can be stress for men as well, can be affecting it. Increased levels of stress hormones in women certainly inhibits estradiol production, potentially resulting in poor quality of the oocyte, and which is like the egg. And also, if you're undergoing IVF, increased levels of stress can result in a lower number of eggs being retrieved. Also, other ways, stress reduces the hypothalamic gonadotropin releasing hormone secretion, which consequently reduces secretion of the luteinizing hormone and follicle stimulating hormone. And because of that, stress can therefore inhibit ovulation. Stress will also bring increased catecholamine levels, which can cause vasoconstriction, and potentially this could reduce uterine blood flow, which of course could potentially affect pregnancy outcomes. Research has shown a link between stress and embryonic death. And again, this is possibly, it's not conclusive, but it's possibly due to, the resulting hormonal imbalances. So, okay, so now we've talked sort of about the effect of stress on fertility, and we talked about the benefits of the benefits that are being advertised with the fertility massage. So I want to talk about, given that we've said, couples going through infertility are at a vulnerable, sort of in a vulnerable state. So I want to talk about whether promotion of this sort of specialist fertility massage, wonder treatment, whether it's unethical and actually misleading to, to the sort of the consumer. Now, ethical marketing, I mean, what does that mean? In terms of healthcare services, it means that the product or service on offer should work, and is only sold to people with an understanding of how their needs will be met. It's not enough just for a therapist to believe in their service. There has to be some corroboration with qualitative research, clinical experience, and thorough understanding of the physiology for it to be deemed ethical. And promotion of any treatment must be supported by evidence, just as our practice is. But there is, very little research available on fertility massage. So it's actually quite difficult to, for anyone to say, yeah, I'm offering this specialist service, and it's backed up by research, because there's been very little done. The techniques, as we've said, the techniques used and the benefits of these fertility massages are actually what would be included in normal massage treatments. And so therefore they're not specialist, and shouldn't be advertised that way. That's not to say, however, that the therapist should not be registered and experienced in the area of pregnancy and reproductive health. Absolutely, these are things that you should be looking for. So from that point of view, I guess you could say you want sort of a specialist therapist in terms of their experience and their qualifications, but the fertility massage itself is not a specialist treatment. Massage for the purpose of reducing psychological stress in order to improve ovarian health and conception is limited. And this is because, as I said, research is only, really more readily available for, the benefits of massage in general with stress, as opposed to the effects of massage on fertility. So again, seek a massage to help you deal with the stress related to your fertility issues. But if you are seeking a massage specifically to improve your infertility, that is not something that any therapist can say, yes, this will help you. They can't. And so because of this, the term fertility massage is misleading. Stress, of course, is just one of the factors involved in fertility issues and may be the result of fertility issues as opposed to the cause. So it wouldn't really therefore be ethical to promote massage as a primary treatment for infertility, sort of on the basis of relieving stress, and therefore it helps, because if stress is a result of the infertility, then massage, even by helping with the stress, it wouldn't be benefiting the infertility which was there in the first place. Certainly through liaison with the gynecologist or midwife, the intention of the massage can be better defined, but it's still certainly, I would say, absolutely unethical to say this is a fertility massage, this will help you conceive. And I think it's very unfair and very unprofessional of anyone claiming to be a therapist, claiming to offer this specialist treatment, because all it actually does is build up the hopes of vulnerable people who, are desperate, to find a solution, when actually there's just no evidence to back it up. But as I say, by all means, you know, if you are having issues with infertility or any of the pelvic health issues that I've talked about at the beginning of this video, you know, by all means do find a qualified, registered, someone with medical or reproductive health experience. You know, do find someone like that and do have a treatment, and it will, you know, certainly there will be benefits, but just don't go into it with the mindset of this is going to help me conceive, because it may leave you, you know, disappointed. So that's yeah, I think just that's really it. Just you know, hopefully any therapist watching this, I'm sure there will be at least one who claims to do fertility massage who will watch this and think this woman is speaking a load of rubbish. But as I say, I sort of my experience as a therapist and as a midwife, I just think that you know, couples struggling with infertility should be protected from misleading information, and you know, this just it's unethical promotion of fertility massage. So, but anyway, any of you, as I say, do look up, if it's an issue for you, my previous videos on things like endometriosis. I've also got pregnancy related videos. Have a look at those on my channel, and feel free to comment down below. Feel free to contact me through my Instagram or Facebook with any questions, and I will come back to you. But for now, that is really it from me. So I will see you next time. Bye.